You're listening to the Ethos Athletes Podcast, where we believe that your health is the #1 resource you need to accomplish your dreams. My name is Dr. Matthew Hernandez, and I'm a physician dedicated to helping my patients maintain their active lifestyle and continue doing what they love. I'm sitting down with other experts so that we can provide our listeners with the knowledge they need to improve their health and live their best life. Hey everyone, this is Dr. Matt with the Ethos Athletes Podcast, and today we're going to be talking about body symmetry and asymmetry and how that can affect your activities and your overall health. And for this particular episode, I wanted to bring in someone who deals with body asymmetry and symmetry every day and knows how to fix it. And that's my good friend, Dr. Jeremy Kerrigan, who is a NUCA chiropractor and owner of the Chiropractic Wellness Institute in Mesa. So Dr. Jeremy, welcome to the show.
Thanks. Glad to be here.
So before we get into our main topic, let's talk about a little bit about what made you become a chiropractor.
Sure. So I've been a chiropractor now for several years, but back when I was a teenager, and even before then, I was kind of accident prone. I like to injure myself. I wasn't really an athlete. I just happened to injure myself frequently. I've had multiple concussions, whiplash injuries that led to, at the point when I was probably about a junior in high school, I started having headaches every single day. And that lasted for about 3-4 years where I had a daily headache. Some were low grade, some were worse than others, but it became my normal. I started having some neck pain, some back pain. My dad had back pain. My grandma had back pain. I assumed it was kind of part of the family tradition that we just had back pain. And it wasn't until I met a chiropractor up in the state of Washington who dealt with this symmetry issue, and she started explaining to me what she did, and I told her what was going on with me, and she said, yeah, I think I can help you. So I worked with her for about 2 weeks, and after the 2 weeks of care, I went 3 months without a single headache. I could stand more upright, my confidence increased. I loved it, obviously.
Yeah.
Who wouldn't love getting rid of chronic pain?
For sure.
That kind of set off the passion, and it took a while, but eventually I went through chiropractic school and became a chiropractor myself because I want to help people in that same way. Yeah,
that's awesome. Now, when we're talking about body symmetry and asymmetry, what is your definition of that?
A word I like to use with symmetry and asymmetry is body in balance and body out of balance.
Yeah.
And so what we look at when someone comes into my office, we look at feet. We compare right to left, see if one's a little longer, one's a little shorter than the other. Then we take and stand them on what we call a SAM unit, or basically a line chart. We have them stand up, and then I take a look at hips, shoulders, and earlobes. And I look to see, is one higher than the other, right versus left, that sort of thing. I look for leaning in the body. So is the bottom of the spine directly under the top of the spine? And that's basically structural symmetry. There's other parts of symmetry. We'll talk a little bit later about more muscular symmetry and that sort of thing. But here in the office, we really focus on that structural. So asymmetry is really any kind of imbalance. If your right hip sits higher than the left one. Okay. A lot of times I'll see women who notice that, one pant leg has to be hemmed a little bit longer, or they're always losing a bra strap on one side, or people will just notice some of that. They look in the mirror and they see a little distortion. One shoulder's down over the other one, that sort of thing. Or they say, I see this a lot too, they say, in pictures, I'm always leaning off to the right side. I can just see my whole head. I try to hold my head straight and I'm leaning that way. That's really what we look for in terms of asymmetry in the body.
Okay, and more specifically, structural asymmetry is like what you mentioned.
Definitely.
Okay, so what causes that? What causes structural asymmetry?
It always takes an accident or an injury. So accidents and injuries kind of tear loose the connective tissue, what is holding everything together. And when that tears loose, it creates this weakness and allows the body to break down and lock into a distressed or an asymmetrical position. Okay. And this can be simple injuries. We see them as early as childbirth. It can be fairly traumatic on a child to come out of the birth canal, or if the birth is drawn out and long, or if there's any kind of complication, it can lead to a little asymmetry even at that point. It magnifies when the kid's learning to walk, learning to run, learning to ride a bike, takes these falls, or as adults we get in car accidents. As athletes, I'm sure they have concussion injuries, they have falls, broken legs, all that sort of stuff can tear loose some of the connective tissue in the spine and then create that asymmetry, or allow the body to kind of break down into that asymmetrical position.
Okay. So an accident or an injury isn't, or I know when I think of accident, I think of like a car accident or a major fall of some sort. It could be something as simple as falling off a bike as a child or different things like that. Okay.
Yeah.
Okay. I think that's good to know for sure. So when someone has an accident or injury, it causes this structural asymmetry. How can that affect their health?
So that distress, that asymmetrical position really adds wear and tear to the body. It's the same as you have with like a car alignment. If the front end of your car is out of alignment, you're going to burn through tires faster.
Okay.
I had one time we replaced something in the front end. I'm not a car guy, so I can't tell you the name of the part. But
you're good.
We replaced it, and we didn't have the front end realigned afterwards.
Okay.
So I drove from here to Utah, and by the time I got to Utah, I had one bald tire and one flat tire. So
Okay.
Middle of winter, sitting on the side of the road, spending 4 hours at a Walmart because that was the nearest tire place wasn't fun. But it's that same idea. If the tires are out of alignment, they wear out faster. And it's the same with us. If our hips are out of alignment, if our body's distorted, it's going to cause more wear and tear on the joints, the articulations, that sort of thing.
Okay.
So that's the hard part about some of these injuries early on, is because it takes years for that to happen.
Okay.
So it could be a fall at age 20 that leads to knee pain at age 40.
Okay.
It's not a direct link because that wear and tear, the body resists wear and tear. Mm-hmm. It wants to be healthy and strong. And so it's gradual over time, and it can lead to a variety of different issues, knee pain, shoulder pain, spinal pain, headaches like I had personally, and a variety of other things as well.
Okay. And you said that, when you experience an accident or injury, your body works to compensate for this, right? And there are some people that might have one leg longer than the other, and that's natural for them. And so you said that the body does compensate for stuff like that, right?
It does. So typically when we're looking at someone, we call it the prone position, or laying on their back, we compare right to left feet. And so if we see an imbalance, usually it's due to an accident or injury. Mm. The medical method, what they do is if they look for a short leg in the profession, they measure femur length. But a lot of times the body's so smart that if your right femur is a little longer than your left one, then the lower part of your left leg will be a little bit longer to compensate for that. So most of the time, 99% of the time, people's legs should be balanced if the spine's correctly balanced.
Okay.
I do have a patient that I've seen for many years now, but he broke his leg when he was growing, so about 10 or 12. And at that point, the growth plates are still open, so the break actually interfered with how the bone grew. Okay. And so as an adult, he has a shorter leg than the other. But the difference is when I check him and he needs an adjustment, he's 3/4 of an inch off. Okay. When I check him and he's good in balance, he's 1/8 of an inch. So it's little things like that. But again, that's the rare exception. If someone if their fracture or injury didn't occur during growth, then it typically should balance out. And so what we see happens though is, like we said, the body does compensate. So if your hips are leaning one way, or even more so than that, we'll see a lot of people where everything leans off to the right. So their right hip is low, their right shoulder's low, and their right ear's low. So what happens is that's the structural asymmetry, but we start getting some muscular asymmetry too. Okay. Because if everything's leaning to the right, the left side of the body has to work harder. So those muscles will either develop bad patterns or they'll actually develop stronger than the right side because they're trying to keep the body stable. Okay. And so we do tie in some other things with other practitioners to try to, once we get the spine in balance, to get those muscle patterns corrected as well. Okay.
And by muscle pattern, you're talking about movement pattern, correct?
Yeah, movement patterns, which muscles are engaging, and even not just movement patterns, but what's it look like when they're sitting still. Okay. Lack of movement patterns. We've been talking a lot more about this because a lot of people sit at desks a lot. Yeah. All the time.
For sure.
And so we have some of these lack of movement patterns where they're out of balance and they're sitting in a desk and those muscles are firing incorrectly. Okay. So that's some of what we're looking at too.
Okay. So at home, and you've given a few examples, but about someone needing their pant leg hemmed a little bit more, what are some things that people can look for at home that give them an idea that they may be asymmetrical?
Yeah, absolutely. A lot of times what I have people do is they'll stand in front of a mirror And it really helps if you have something like lines on the back behind you, you know? So if you have a wall with painted stripes or something like that, that works really well. And you stand there and you can just look and take a look at shoulders, take a look at the head. Is your head leaning right or left? And that's not just like postural, that's more structural than anything. And just looking at that, I have patients, because of our office and our uniqueness, people drive to see us. And so if they're driving 3 hours, I say, well, you know, here's a few checks. If you start noticing the shoulders are off, then definitely come see me. You know, if you're feeling a little achy for a day and they're not off, that's just something your body's working through type thing. So that check in front of the mirror, or even, you know, just stand on the wall and have someone look at you. You know, if you have that same wall and not a mirror across, have someone take a look and see what they see. Sometimes they're obvious, sometimes they're subtle, especially for people who are very athletic, very active, and taking care of their health. The findings might be a little more subtle and harder to see, but they may still be able to see signs of that.
Okay. And some of the common things that you see, or you say your head tilts one way or the other, one shoulder's higher than the other.
Yeah, those are the easiest ones to see. We also look at hips and feet, but it's really hard to lay on your back and see what your feet look like.
Right, right.
So
yeah, absolutely.
Those are the ones that you can check at home, but we can check a couple of more in the office too. So.
Okay. So let's go back to the wear and tear that some of this causes. So you said over time, as structural asymmetry exists, you begin to have this wear and tear. Can you give me an example of what that looks like?
Yeah, so when we take like an x-ray of a spine or something, we look at common terms are arthritis, degeneration, things like that. But at the same time, if you think about like in architecture and design, if you're going to build something with weight balance in place. And so one of the things that'll happen, like one of our checks we do in the office actually is we measure weight on right and left and split it. So if I had a patient one time who was putting 135 pounds more weight on his right foot than he was on his left. And most patients fall in around 20, 30 pounds, something like that. But if you're putting 30 pounds more pressure on your right foot, that weight is going all through that side. So it's getting more weight on the hip, more weight on the ankle, more weight on the knee. And so what that does is it'll lead to either some compression of the articulations, it'll lead to some distortion. Maybe the knee kicks inward or outward a little bit. Sometimes those aren't visual, but it's 2 or 3 millimeters this way. So it kind of wears that joint down faster than the other one. And typically that's how it starts. Very rarely does someone say, yeah, I just started having knee pain in both sides. Usually it starts with one because it's worn out more, and then they start compensating, and so then it spreads to the other. But a lot of times it ties in. Whichever leg they're putting more weight on is the one that they started their pain with.
Okay. And arthritis is a great example of that, like you said. Yeah, absolutely. Okay, so we know what can happen. This wear and tear is the most common thing that can happen when your body has asymmetry. What are some things that we can do to fix it?
So the biggest thing, I mean, once it's to that point where you have that wear and tear, you've got to look at multiple things. Obviously getting the asymmetry, and the method I use here in the office for that is called NUCA, National Upper Cervical Chiropractic Association. It's a very specific technique about getting the entire body back in balance, back symmetrical with one adjustment. Granted, we have to repeat the adjustment maybe over a few visits here and there as the body tends to go back to that asymmetrical position. But when they come in the office, we adjust them in the neck typically, and then all of that balances back out. And then we have to do some retraining, train the body that symmetrical is normal, because if it's been there a long time, asymmetrical is the normal for the body.
Okay.
And then we also have to dress. I mean, that's where your specialty comes in. We need to dress the joint damage at that point if it's severe enough. So doing some of the great PRP work that you do, some of the other therapies really can help rehabilitate that joint. And then like we talked about, there's structural imbalance or asymmetry, and there's muscular. And sometimes those muscular asymmetrical patterns are pretty ingrained. And so what a lot of times we'll co-manage or co-work with a physical therapist to help rehab, retrain those muscles to now help maintain a symmetrical position. So the muscles aren't pulling them back out of alignment, back into that asymmetrical position.
Okay. Yeah, that's really good. And that team approach in addressing all those has really worked well in our experience for improving joint pain and just helping that overall. What have been some of the the things that you've seen it help with. So we've talked about knee, and I know from experience working with you and co-treating some of your patients that we've been able to fix knee problems. What are some of the other things that you've seen NUCA be able to help with, just with fixing the symmetry of the body?
Absolutely. Like going back to my own personal experience, those chronic tension headaches, kind of working down the chain, headaches, the obvious for chiropractics, headaches, neck pain, and back pain.
Right.
Those are, kind of the staples. But there's a variety of other areas that get affected. If you're asymmetrical, that's going to have a neurological component as well.
Mm-hmm.
It's going to affect the nerves. And so we'll see people who start getting some maybe numbness and tingling because the hip imbalance is putting pressure on nerves that doesn't allow them to flow properly. So we'll get hip, numbness and tingling down the legs, maybe in the hands, a lot of times up in the shoulders, that sort of thing. And then we even get in, the NUCA approach does lend itself to other areas or other problems that are more neurological. We have some conditions like trigeminal neuralgia, Meniere's disease that we've been able to see results with. Or going to more common, two of the big things I see are, hey, I'm tired all the time. Mm-hmm. And if you think of your body being out of balance, it's like when you're holding a big heavy weight close to your body, it's easier to hold. But if you hold it out farther, it takes more and more work.
Yeah.
And so when your body's in balance, it takes work to hold it up, but it's easier. When it's out of balance, it takes more energy, so people end up being more tired, have a harder time getting started in the morning. Or a very common one that we see is this brain fog. I put that in quotes, like brain fog. It's not really technical diagnosis, but I will see a lot of more women than men for whatever reason. But they'll come in and they'll say, I get times where I just can't think very clearly. And a lot of that has to do, your body only has a certain amount of energy. And if it's using that up to just maintain your body balance, then it's not going to have that left over for other functions. So those are common things. People get more energy a lot of times after adjustments, and they are able to think a little bit clearer at times too.
Okay. And I will say, so I've been adjusted by Dr. Jeremy as well, and this NUCA approach to adjustments is completely different from what you traditionally think with chiropractic. This is probably the most gentle adjustment you'll ever see. I don't know. I mean, I know several different types of chiropractic methods, and I don't know of anyone that's more gentler than this. But it works really well. I mean, now you mentioned, I know one time when we were talking, you said that there's a handful of NUCA chiropractors here in the state, correct?
Yeah, there's 4 of us here in Arizona.
Yeah,
There's about 300 of us worldwide, mostly in the U.S. and Canada.
Okay. Yeah, so it's definitely a specialty certification that you need to work on. And
legally, I can't call it a specialty, but it is an area of focus.
Okay, yeah. So
we don't have specialties in the chiropractic profession.
Fair enough.
It is. I mean, it's been my area of focus for over 10 years. I started studying it first thing as soon as I started chiropractic school, and I continue to do. I did that yesterday. I have continuing education next month too, just to focus in on this particular method. So.
Yeah, awesome. So just to recap what we talked about in this particular episode, so we talked about body symmetry and asymmetry, or as Dr. Jeremy likes to refer to it, body in balance and out of balance. And when we have this asymmetrical problem, what can occur is you start to have compensations that can lead to wear and tear of a given joint, which can then obviously, for our listeners, affect your performance down the road. And this wear and tear, or this joint pain that you're having today, is a result of this asymmetry that you experienced, could be several years ago. So keep that piece in mind. What we discussed 2 different types of symmetry and asymmetry. There's structural asymmetry, and then there's muscular asymmetry, and where Dr. Jeremy comes into play is for the structural piece. And then that's the most, baseline you can get and in fixing that. And then, because structural asymmetry leads to muscular asymmetry, which then leads to joint pain, all that other stuff, which, that's when you're in my office at that point.
Absolutely. Yeah.
So if you want to take care of this problem beforehand, make sure to get these asymmetries looked at by someone who deals with this every day, such as Dr. Jeremy. So Yeah, that's a little bit about what we talked about today. If you'd like to learn more about Dr. Jeremy and his practice, they can go to, what's your website?
azspinalcare.com.
So azspinalcare.com. We'll make sure to post that in the show notes as well. And in the meantime, Dr. Jeremy, thanks for being on the show.
Yeah, thanks for having me.
Hope you all learned a lot, and we'll catch you on the next episode.